This lecture is being brought to you in part by the generous gifts of these sponsors.
Okay. Check. Yep, everybody can hear me? Thank you. Thank you for coming. Always humbled to get those kind of introductions. So again, my name is Johnathan Edwards. And easy, I am not Johnathan Edwards, the preacher who recanted the sinners in the hands of an angry God. So, but I have the same name. So anyway, we'll get started. And the other thing is, like, I gave one of the first lectures in Ocala, and it's pretty neat. I'm giving the last lecture here in Pensacola for 2025. So anyway, ketamine, anesthetic to healer. So that raises many questions. Everybody asks me, like, how can ketamine be an anesthetic agent and a healer? There's many questions. Is it safe? Is it right for you? Is it right for your loved one? Why is it important to have trust in who gives you ketamine? And how does ketamine stop suicide in its tracks? We'll discover all that tonight. So I have a story. Every suicide ends one life, and it rolls of the grenade into the lives of many others. I experienced that firsthand. I was 7 years old. My grandfather sat on his couch and put a shotgun to his chest, pulled the trigger. My parents brought me over to my grandfather's house and my grandma, and I remember seeing that couch. I remember seeing the other room. I was 7 years old. I saw my parents, my grandmother, and my aunts and uncles wailing like I'd never seen before. And I was just trying to make sense of it all. And I've thought about that day ever since, and it's influenced why I'm here today. Suicide. It's a powerful word. Many people in here have experienced suicide, yet it's not talked about a lot, even though somebody actually dies from suicide every 10 minutes. Hardly anybody talks about it unless you bring it up. And then once you bring it up, it seems like everybody has a story. We know the mental health crisis just made it worse. But there is good news on suicide, and it can be as simple as just bringing up a conversation. Starting the conversation can save lives. So let's go over what are the causes of suicide. Well, it's depression and loneliness. So over 9 million men, women, and children will be diagnosed with some form of depression. Out of that 1 million will go on to attempt some form of what we call suicide. And about 50,000 people will successfully take their life by suicide. And since 2020, that number is 50,000 consistently. That's the most since World War II. So it's something. It's something to think about. What is suicide? Here's what are the ingredients of suicide? It's isolation, severe isolation. It's severe hopelessness. Usually it means there's a burden. You're a burden on the family or society or in your environment. In a moment of severe vulnerability with access to a lethal means. That's it. Usually it's associated with lack of access to care. Yet 50% of those who take their life by suicide will never give any signs at all. Now that's a layperson's definition. Of course, psychiatric and psychologists who are experts in suicide can actually detect it at a much higher rate, but that's just to be clear. So what about the growing statistics in suicide? Most people don't know that it's the second leading cause of death in children 10 to 14 years old. How did we get there? Globally, it's the 4th leading cause. In the US, it's about the 11th leading cause, which was just kicked out from the 10th by COVID. 40 veterans die per day, or I should say 40 service members. We used to think that number was 20, but it's anywhere from 20 to 40. It's very high. The media, why does the media rarely talk about suicide? I mean, isn't 50,000 people a big enough number to raise some level of concern? Apparently not. I mean, that's like a fully loaded Airbus or 737 crashing to the earth every day like a lawn dart, all souls lost. Doesn't stop there. We have the overdose crisis, which takes over 100,000 lives a year, and how many of those are actually suicide? If you don't come with a note, you're labeled an overdose. So, children and suicide, that's a hard subject. Children experience suicide much differently than adults. 50 years ago, it was almost unheard of. It was the curve was flat. It's just actually since 2008 that we've seen an uptick in children and suicide. And what does that correlate with? Advent of technology and the phones, and not far after that, social media, which we're going to get into. According to the NIH, or the National Institutes of Mental Health, 4 million adolescents aged 12 to 17 were depressed in 2022. That number is similar today. We know the lockdowns played a role in that. Former CDC Director Dr. Redfield stated that 7 million children would lose their access to mental health services because they receive it in the schools from the lockdowns. The Las Vegas suicide crisis, I practiced in Las Vegas for 20 years. 18 school-age children in 2020, the height of the pandemic, took their own lives. And these aren't kids with a psychiatric history like severe bipolar disorder. These were depressed kids with all the ingredients of suicide that I just went over, the isolation mainly, hopelessness, and being a burden, and they all had extreme moments of vulnerability. And what was their lethal means? School-issued iPads. That's how they looked up how to take their life. So, social media, it's this generation's cigarettes. It gets them hooked and hooked young. It's a phenomenon called variable reinforcement. So adolescents spend 7 to 8 hours a day on these smartphones. Awareness can be corrective in itself. A great book is by Johnathan Edwards, The Anxious Generation. Maybe some of you have heard of it. But anyway, many like him have written about it, and it's nothing to ignore. Veterans and suicide, that's a very important talk, especially at IHMC, because there's a lot of research going on with veterans. Combat's no longer the leading cause or leading killer of soldiers. It's suicide. And as I said, 20 to 40 service members. When a soldier goes to war, they don't really know themselves or what they're getting into, and very bad things happen on the battlefield, things that they're not even capable of knowing that they're capable of. And they find out there's more to them than they thought possible, and that's when PTSD ensues and they fall apart. And most people just say, just get over the PTSD. You can kick it, and that's wrong. That's a wrong way to think about it. It's not you can get rid of PTSD. It's that PTSD won't let go of you. That's the right way to think about it. Veterans own more guns than most of the population, and they're very well trained on how to use them. And as we all know, governments send soldiers to war and with no hesitation, but when they come back, they hate paying for their mental health care. Every president since Nixon has rolled out some kind of plan to decrease suicide, yet the numbers keep going up. In the Iraq and Afghanistan wars, you got 3 million veterans, 100 million traumatic brain injuries. Suicide rate, as I marked before, over 150,000 suicides since 9/11, and nearly 2/3 of these veterans suffer from post-traumatic stress disorder and treatment-resistant depression. What is treatment-resistant depression? That's not your run-of-the-mill depression. That means you've gone through 2 medications after several weeks of treatment and you have not gotten better. And treatment-resistant depression is significant because that's the one that leads the next to suicide. We're not talking about regular depression that you have for a couple weeks. Treatment-resistant depression is the important thing to hear. And what about if we throw more money at suicides? Well, here's a slide from the VA and the annual suicide prevention budget. Well, as you can see, since the early 2000s, the more money you throw at it, the higher the rate of suicide. Obviously, just like many things, it's whatever we're doing isn't working. First responders and suicide. So this is also a very difficult topic and an important one to IHMC. Did you know that more firefighters and police officers die by suicide than in the line of duty? In 2024, I was here with IHMC in the Blue Sky event on how to address and increase mental health services within fire department stations. Why? Because the suicide rate for Florida firefighters is that high. And just before we did this event here, one station had 4 suicides. That's a lot if you think about it. Think about who a firefighter is to the community. These are the people going in and picking you up out of the smoke and saving your life. It's a big problem. And then just after I gave my another speech on this in Ocala, the fire chief came up to me and said there were another 2 victims. So it's an important problem right here in Florida and across the country. PTSD is one of the major causes. Think of PTSD as a rut. It's a rut you can't get out of no matter how hard you try. And in technical terms, that's called the default mode network. And anybody in psychology or psychiatry or even parts of medicine knows what that is. And we'll get more into that. What's interesting is for PTSD, there's been other therapies like MDMA. It showed promise, and even in stage 3 trials at Johns Hopkins University, yet the FDA wouldn't clear it. So that brings up another point. More and more politicians are actually getting behind psychedelic therapy. You can actually look them up, and if you, the head of the HHS, Robert F. Kennedy, is actually supportive of using psychedelics in mental health. So, and he's not alone. There's dozens of others who also support it. So it's an important topic. But the truth is, ketamine is the only drug that's legal and available today. We have for treating PTSD, suicide, and other mental illnesses. You can't use psilocybin. You can't use any of the other MDMA legally. In studies you can. Ketamine is it. It's the only one we have available that physicians can use and prescribe. So, how did I get in all of this? What's my transformation? So, during medical school, I was always intrigued by mental health and suicide, and for part of my history of how I grew up, and I asked those difficult questions. And something I learned a long time ago, there's a Latin phrase, "Stare quillinis en vaniture," or en vaniture, sorry, it's a little French there. What you need most will be found where you least want to look. It means finding something in the mud. So in my medical career, I've had the privilege of working with national best-selling authors, and he's pretty well known, Gavin de Becker. He wrote The Gift of Fear, been on Oprah several times. He painfully lost his mother to suicide, and one day Gavin asked me, we had a relationship, and he asked me, Johnathan, what do you think about ketamine? And I was kind of taken aback. I was like, well, that's kind of a softball question. I'm a board-certified anesthesiologist, and I said, yeah, I've been using it for 20 years. I use it a lot in pediatrics. It's safe. It doesn't. It's on the WHO list of essential medications. But I said I also knew that it was a repurposed drug, repurposed because it could treat depression, mental illness, and stop suicide. And Gavin responded. He said, Johnathan, he's an interesting fellow. Anyway, he said, I'm glad you answered the question that way, but I was prepared if you had answered the other way. So I was kind of taken aback, like, well, what does he mean by the other way? Well, the other way is the fact that most healthcare professionals don't even know about ketamine. They just think of it as a horse tranquilizer, or it's a party drug of abuse. Us in emergency room and anesthesia know of ketamine very well, but very few know of its use, if it's repurposed for mental health. So what makes ketamine so important? Ketamine is the most important breakthrough in mental health in 50 years. I didn't say that. This is Thomas Insel, MD, former director of the National Institutes of Mental Health. And as I said, most healthcare providers are unaware of ketamine's potential to treat depression and stop suicides. And as I said, it's been safely used for decades in children and others. Gavin and I agreed that day that the world needs to know about a little-known drug called ketamine. So that's what led to my book, The Revolutionary Ketamine. As you can see, I wrote it there, published by Skyhorse, a subsidiary of Simon & Schuster. Why? Because the discovery of ketamine as a rapid-acting antidepressant led to a new era for the first time in neuropsychiatric therapeutics. Before this, we were just doing electrical convulsive therapy or high dose or lithium or things like that, but now there was a new indication for severe mental illness, such as suicide and treatment-resistant depression. Instead of waiting weeks to months, a single dose can actually stop suicidal ideations and give the patient time to regroup or maybe not be institutionalized. And we'll get more into that. And it's very important. When paired with psychotherapy, ketamine is staggeringly effective. We've never heard of these kind of results until now. And I will emphasize, ketamine must be paired with psychotherapy. I don't give it without that. A lot of people come to me and just say, oh, just please give me the ketamine. No. You have to be in conjunction, and we'll learn more about this in a minute. You've got to be receiving therapy at the same time, and I can't emphasize that point enough. One of my favorite studies is from Dr. Lori Calibri. She's a Connecticut psychiatrist, private psychiatrist who happens to do a lot of research. In 2019, she published a study involving serial titrated intravenous doses of ketamine, along with therapy for about 230 adults and adolescents. Again, with treatment-resistant depression and other psychiatric comorbidities, which include bipolar disorder and eating disorders, and also suicidal thoughts. 82 saw diminished suicidal ideations, and almost 70% achieved full remission, What's important, this is a real-world outpatient study. This isn't Yale. This isn't the NIH. This isn't an academic laboratory. This is like a psychiatry clinic that you might see on a street, just going around town. There were no suicide attempts. There were no ER visits or psychiatric hospitalizations. And one way you can think about this is ketamine is fertilizer for the brain, meaning there's reasons ketamine sets you up to receive or optimize your therapy at the same time. Her latest research involves combining the ketogenic diet with ketamine and therapy, and she's seeing significant results with that. And as you know, many others are writing about the wondrous effects of diet change and basically correcting insulin resistance, like Chris Palmer, for example, using diet to treat mental illness disorders. So, ketamine's unusual history. So it was synthesized in 1962 by Dr. Calvin Stevens, and it was in response to anesthesiologists. And so the anesthesiologists were at the time using a drug that came before ketamine called phencyclidine. And some of you in the audience may know that phencyclidine is a derivative of PCP, or angel dust. Anyway, so it was used in the 1960s. And the problem with it is it caused post-operative delirium, which means patients didn't know where they were. They were uncontrollable, anxious, stressed. And why is this important? Because when you have delirium after an operation, your chance of dying is greater. And we know this through many other studies in delirium. So ketamine was born, and then it quickly became the most utilized anesthetic worldwide. Why? Because it's safe. Compared to other anesthetics like phenobarbital or other thiazines, things like that, or gases even, ketamine does not suppress respirations to any great extent, nor does it cause hemodynamic or that means blood pressure and heart rate changes compared to other anesthetics. And the other thing, that makes it, you can use ketamine without the need of oxygen or hemodynamic monitoring. Why is that important? We're all used to a Western form of medicine. I've practiced in Senegal, Mexico, Peru, other places in South America. I've practiced in France. The whole world is not like what we have here. We're privileged. Most medicine happens in tents or in places you wouldn't want to be. So imagine there's no electricity. You could use a drug like ketamine and have some confidence that their breathing is not going to decrease. Vietnam War is a special part of history of ketamine, even though Nixon waged war on all the psychedelics, as you may or may not remember. Ketamine was fast-tracked. Why? Because it was a battle buddy drug. Meaning, you could have your soldier who was wounded, and you could give them ketamine and safely know that they're not going to stop breathing on you, and their blood pressure was, going to not hopefully be stable, depending if you're bleeding or not, but they could get them to the MASH unit, and it would also dissociate their pain, and so it became very popular. Unfortunately, just like other drugs, it also became abused. But that happened with morphine, as you know, and many other drugs during the Vietnam War. It's on the WHO list of essential medications. So that means it serves the important need in a basic healthcare system. So, as I said, most of the world doesn't function like westernized medicine. Many ask, is ketamine safe? Many say, oh, there's research gaps in it where we just don't know. Wrong. I say that's wrong. There's enough research on it. And it just got to go back to Yale in the 1990s in my book, and you can just go on PubMed. But there's been 70,000 PubMed articles that exist about ketamine, highlighting its safety. Of course, it should always be given by a professional. And just to give you an idea to emphasize this safety, so most have listened to Michael Jackson's music, and most know that he died in a Los Angeles bedroom while given an intravenous infusion of propofol, which is another anesthetic that has a more dangerous safety profile, and he stopped breathing and was unresuscitatable. Just to give you an idea, if he was given ketamine instead of propofol, he would still be here and we would still be listening to his music. Why? Just for the reasons I've said. And also, ketamine has a predictable on and off effect. Some say there's bladder issues with ketamine. Now, this is important to highlight. Street ketamine is the one that's associated with the bladder problems. Intravenous pharmaceutical grade ketamine is not. Street ketamine is a different animal. It's made on the street. It's impure. It usually has things like fentanyl, which is responsible for many of the drug overdose deaths, laced in it. And they take it in grams. Pharmaceutical grade ketamine is given in a clinic in a therapeutic setting in 1/10 of the dose, usually intravenously. And we don't have the same problems with it. However, there is a potential for addiction, especially the misuse outside of medical settings, as we saw with the actor Matthew Perry. All the headlines said, oh, Matthew Perry died from a ketamine overdose. Well, there's more to that story, and I actually wrote a Substack article on that. There were other drugs involved, and Matthew Perry was a heart attack waiting to happen. Most people don't know that Matthew Perry used ketamine, for lack of a better word, correctly in a ketamine clinic for many years before his death, when he started misusing it and abusing it. Basically, he was taken advantage of by the doctors who were helping him, and the assistants especially, who were probably helping him administer the medication. But it's just to highlight there is a potential for addiction and abuse, and bad things can happen. That's the exception. So what's ketamine used for? So some things you may not have known besides the mental health space. We've already said depression. But did you know it's used for pain management, for things like chronic regional pain syndrome? It actually has effect on some of the pain receptors. And it can actually reset pain receptors. It also cuts down opioid use. That's great. Anything we can do to use a non-opioid technique in anesthesia, pain control is better. I'm not an advocate for completely cutting them out, but ketamine can cut down opioid use. It's also used in anxiety and PTSD. Some modes of, as I said, it's standard, it's given intravenously, can also be given intramuscularly. It's a drug that can be given intranasally, oral, and even subcutaneously. So, how can ketamine help? Well, let's take the scenario. What happens in today's society if somebody screams suicide? Well, the normal chain of events is you're against your will, you're institutionalized, given sedatives, and put in basically isolation and 24-hour monitoring so you can not be a danger to yourself or others. Now, that usually causes more trauma. And it's true, when somebody's in a manic episode, you don't want to give ketamine. That's not the time to give ketamine. Ketamine needs to be given, think of it, it needs to be given with the risk, benefits, and alternatives. And what does that mean in layman's sense? It means given by invitation, not forced. That's how ketamine should be given. It's not a drug you just give and expect a result. There's many other things, as we're going to see, that ketamine has to be given because it produces a biological, a psychological, and a spiritual experience. And we're going to get into that in a minute. So, ketamine has the potential to stop this cycle. Imagine I have many colleagues who give it in the emergency room, and I've heard of many stories, including my own, where the patient afterwards said, "Thank you." So those are some, and there are studies on this anyway. And then the other thing most people don't know, and this is a point of controversy: can it be given at home? Well, there's a lot of sub companies out there like Mind Bloom and others who are sending ketamine to people's homes. Is that a good thing or bad thing? Well, you could argue both ways, but we're going to get into it. But the crux of that is that ketamine is usually a cash pay basis. You have to go to a clinic. So there's many people who live in rural communities who will never have access. So those are some of the pro and con arguments for home ketamine administration. Okay. Good news. I know that was a lot of, oh my God, those are hard. That's a lot of melodramatic and kind of downer information about children, suicides, veterans, first responders. I get it. But let's look at how some lives were transformed by ketamine. So I'll give you some of my favorite stories. I write about this in my book in the New York Times in 2012. Dennis Hartman, he was a businessman from Seattle. He's quoted saying, "I look at the cost of not using ketamine. For me, it was certain death." Dennis had suffered from years of treatment-resistant depression and had a suicide date ready when he entered into an NIH-sponsored ketamine treatment program. After he received the ketamine, his depression lifted. He receives it as needed. He even found his stories all over the ketamine advocacy network, which he created. One of my own patients, and a compelling story, is the Mandalay Bay Massacre, which some of you may remember. 2017, Las Vegas, Nevada, during country music singer Jason Aldine. A very sick person fired from high on some floor of the Mandalay Bay, killing 58 people, 850 injuries. Dan will call him. He was a first responder to that scene. He still suffers from PTSD to this day, and he can never unsee what he saw. Despite psychotherapy, antidepressants, and other modalities, for him, ketamine's the only thing that helps. And he still receives ketamine monthly, just as needed, but it's changed his situation. And this isn't an unusual story for first responders. Iraq war veteran. How can it help in our veterans? Well, Mike Donnelly, he was suicidal, had PTSD. He presented himself to the VA, and the physician assistant who saw him just said, "Here's a card and call this number," and gave him a pat on the back. That's not what you do with somebody who's suicidal. That's the last thing you do. And that's an example of how our healthcare system is broken and how we treat our veterans. He's at the end of his rope, no job, he's losing his family, planning his suicide, all the classic signs. So he read about ketamine and the potential that it could help him, but he couldn't afford the treatments. As I said, it's only cash. And there's about 400 ketamine clinics in the whole country. You can't just go to the ER and say, give me ketamine. It doesn't work like that. So finally, he sold his prized guns, got the treatments, and he received ketamine, improved, and became a father again. So, and there are organizations specifically dedicated to helping veterans afford these ketamine treatments. One of my patients was an adolescent, 17-year-old, presented to me as wanting to kill himself, suffering severe social anxiety and depression. And so his parents brought him in, and as most patients in this situation he was seeing a psychiatrist, but he did not want to go to the hospital at this time. So his parents brought him in. I gave him one ketamine treatment, and the suicidal ideations decreased. I gave him a second ketamine treatment, and of course he received therapy in between that and between treatments. He could see things that were changing. Depression was less. After 3 treatments, this young man started seeing that he had a future and wanted to move on and improve in his life. And by an act of will, he could control this obsessional thinking that led him into the dark place where he wanted to take his life. And he even stopped his antidepressant medications eventually. In my book, I describe Olive's story, and it's from another clinic. Wasn't my patient, but Olive was a young girl, lifelong history, depression, PTSD, bipolar, multiple suicide attempts. At 26, she decided enough was enough and booked a ticket to the Netherlands for a compassionate euthanasia, which is a big topic right now, which I'll get into a little bit after this. And it's also important to highlight here that most suicidal people desperately want to live. They just see no other way to control their pain. Anyway, the day she was to leave, her friend convinced her to go to a ketamine clinic. She received 3 treatments that week, and she never booked that flight. Now, I'll say a note on euthanasia. I mean, I'm not sure, there's many, Canada, I'm not sure if you know, euthanasia is now the 4th leading cause of death in Canada because of their MAID program. They're first now, and the Netherlands is second. And they're actually voting on whether mental health is a proper diagnosis for somebody to consider euthanasia. Again, how did we get there? I don't know. Another one of my patients presented with prostate cancer and suicide. A 53-year-old, recent diagnosis of prostate cancer. He was put on the testosterone blocking drug, as many are with prostate cancer, called Lupron. Presented with 9 out of 10 suicidal ideations. Again, refused to go to the hospital. He said, I would take my life now if I had the right situation. He also, too, was a veteran. But he never had a history of suicidal ideations, a very spiritual guy. And one thing I've learned through my treatment of mental illness and suicide patients is I tell them, well, you can always do it tomorrow. Why is that significant? Because it's true. It's one way to get them to start thinking about one step at a time, something in the future. And that can that's the conversation that can help people who are acutely suicidal. He underwent a ketamine treatment. This abated his suicidal ideation, saw a psychologist, even a Reiki healer, and even he got on THC and stopped the Lupron, underwent several sessions of the radiation, prostate cancer treated. He repeated ketamine treatment later and had an enlightening experience. And anyway, it's an example of where that one treatment helped him, and that's all he needed. So, another one of my patients is an elderly patient with a history of child abuse, and I gave him a ketamine treatment. He said for the first time ever that after his treatment, he viewed his adult self through his parents' eyes and realized that no, he wasn't a bad person, should not be ashamed. And many people who get a ketamine treatment speak acceptance, a sense of being enough. And almost everybody says everything's going to be okay. That is something you hear again and again and again. Why isn't ketamine a standard pharmaceutical? I've always thought that was a good question. Well, pharmaceutical companies, and they are trying, they would just like to pack ketamine into a pill. But you can't do this. Because as I alluded to before, ketamine is a biological, a psychological, and a spiritual experience. You can't just pack that into a pill. The other reasons they don't want to really tackle it because it's out of patent. Its use is off-label, actually, for mental health disorders. But do realize 80% of all drugs are prescribed off-label. Spravato, it's a form of ketamine called R-ketamine, and it is FDA approved for psychiatric conditions. It's intranasal, has to be given in a clinic, and you have to get approval from the insurance company. As I mentioned before, there are safety concerns. Matthew Perry's death, the stigmata of it being a party drug. But one thing I want to keep repeating through this, there's not enough mental health providers advocating its use. I'm not saying it should be used in every case, but at least they should know it's an option. And then, of course, they're not going to fund research that isn't profitable. Most people don't know that ketamine has a plant-based origin. It's made synthetically, but the Peruvian torch cactus contains precursors of ketamine called hydroxynorketamine. The bark of acacia trees, which maybe you all have a couple hanging out in your backyard, has ketamine, and it's in its bark. So while ketamine's synthetic, just realize that it was plant-based psychoactive compounds that led to its inception. I often get the question, is ketamine a psychedelic? Well, from a research standpoint, they say no. But I say ketamine is a psychedelic. Why? Because there are studies that shows it touches these things called the 5-HT2A receptors, which I won't bore you with the details there. And the primary mechanism involves, why does ketamine work? It works by blocking NMDA receptors, modulation of the serotonergic pathways, including that of the 5-HT2A, leading to neuroplastic changes. Ketamine produces everything about a psychedelic experience. It transcends physical reality. It produces a mystical experience. You get loss of ego, called ego dissolution. You get usually a loss of what time is. Also, oceanic feelings, which kind of that wavy, everything's good. Visual hallucinations and integration. Again, it's a biological, psychological, spiritual experience that cannot be put into a pill. And this, I like to highlight this this picture here. This is a hand transcending reality, and my daughter Charlotte drew that, so I was very proud to put it up. So again, how ketamine works? Like I said, it blocks the NMDA receptors, which increases glutamate. As you know, Mark Madsen did an IHMC STEM Talk podcast all over this, and he has a book specifically on this neurotransmitter. Glutamate is so important. It's the reason why after years of never riding a bike again, you can still ride a bike. That's the power of glutamate. It can promote the growth of new neural connections. That's called neuroplasticity. It's responsible in mood regulation, cognitive function. And this is how it treats the biological problem. It also increases proteins called mTOR, which you may have heard of, and BDNF, which is brain-derived neural growth factor. And lo and behold, guess what? BDNF is severely depressed in suicidal people. Also depression. So it treats the biological root cause of depression, but mental health it's more than just the absence of mental disorders or disabilities. As I keep repeating, it's the mind, body, spirit experience dissolving time and ego and taps into the language of the human psyche. Famed psychologist Carl Jung once said, the psychotherapeutic endeavor is the pathway to truth. So that's part of the reason it works, and that's why the therapy is so important along with ketamine, or any other psychedelic for that matter. Anyways, it helps people process complex emotions, past traumas, work towards inner healing. And remember those, going back to the ingredients, it changes the hope equation. That's how I like to explain it. So, and to get back into the spiritual or the trust part of ketamine, something that's missing in our, I'd say in many parts of our medical establishments nowadays, is trust. It's crucial to healing mental illness. Ketamine is not a treat-all, like a standard of care. But most don't ask the questions of why do we need trust and spirit in helping people with mental disease or many things like fear of needles. Trust goes a long way into helping people with fear of needles. Like I have many patients tell me that, when I insert an IV, it's different than others. It's because I establish a base of trust before I ever touch that patient. Whether it's through my approach, my gaze, my presentation, but I work very hard at that. And I would say it's not appreciated enough. So anyway, that gets into like, does it matter who's administering the ketamine? I would say yes. Anyway, trust can alter this fear in many ways. And again, what about this spiritual question? The holistic model revolves around the interplay of body, mind, spirit, which I keep harping on. Those first two are obvious. We can all have discussions about the biological and psychological. But when the spiritual discussion comes up, it's absent from allopathic medicine, mostly because it has this materialistic paradigm. But how do you introduce it? Well, it's hard to introduce it because it's not acknowledged in allopathy or allopathic medicine or Western medicine. And there's a high probability of it being misconstrued. But I would argue that we all need a humility that allows us to go beyond the biological and psychological and add that spirit part. And that's only going to come through different types of training and realizations that we have a problem in it. So, but yet, most people, when I open the dialogue, just about everybody accepts it to some extent and at least thinks about it. So that was the point of explaining that. So I wrote. So here's some history, some cool stories. I wrote a book before the Revolutionary Ketamine called Suicide, COVID-19, and Ketamine. That was the book that actually came out when Gavin de Becker asked me if I wrote the book, he would write the foreword. And it highlighted, it was a dark book highlighting the consequences of the lockdowns, talking about children and suicide. And one night I was at the, if you know who CrossFit is, there's a gentleman named Greg Glassman. He holds a conference called the Broken Science Institute, and I was there, and I was Jay Bhattacharya. He's the new NIH director, happened to be there. And Jay and I were talking about the book, and I was and I mentioned my name to him, and he paused, and he goes, "Wait, you're Johnathan Edwards?" And I looked at him. I go, "I know who you are, but how the heck do you know who I am?" And he goes, "Well, he read the book because nobody else in 2020 was writing about these things, and so it was interesting, and we keep in touch even to this day." So that led me to the Revolutionary Ketamine, which again was published by Skyhorse, and allowed me I focused more on veterans, first responders, children, and athletes. And I did the audio book for the Revolutionary Ketamine. One of my highlights of the Revolutionary Ketamine was presenting my book to Jordan Peterson. So I got to meet Dr. Peterson, excuse me, and he had a hard time with ketamine. He quote, I tried ketamine for my depression at the advice of my physician at the time, and for me it was 2 days of hell. So I got to pose the question. I said, well, what about ketamine and mental illness and the fact when it's paired with psychotherapy? And so we got to have a one-on-one talk about that for a good period of time, and at the end of it, he agreed that when paired with psychotherapy, things like ketamine and other psychedelics have a mainstay in the treatment, and he was supportive of it. So, other places my book has taken me is I get to discuss ketamine and trauma with athletes. I work with many, I've been a doctor for professional cycling. I help many UFC athletes, motocross athletes. That was, and also tennis. So as you know, in the UFC and motocross, there's a thing called chronic traumatic encephalopathy, or CTE, and there's a big suicide component to that. And I actually had a couple athletes who took their lives by suicide. And then so I've gotten to talk to all of them, and then you can see at the bottom there's Darren Waller and myself. He's a tight end. He was a tight end in the NFL. Misha Tate, I've been working with her since 2016. We've talked about that. On the right, there are to my right, there's Francis Ngannou. He was a UFC athlete as well as a boxer. So I help him. We speak French together, but he understands the role of ketamine in treating CTE. And Aaron Rodgers once said this about ayahuasca: it's a top of the mountain experience, and we're pushing ourselves to the edge with various medicines. Why? Because my life matters. Because I have a host of ancestors backing me up. So I've always liked that one. My book also took me to the Supreme Court, where I wrote part of the amicus brief for, I don't know if you're familiar with the U.S. versus the Scarametti, Tennessee Supreme Court arguments for the detransitioners. There I am with Chloe Cole, and it's not to so much go into that topic wherever you stand on the issue. It's more about when Chloe and I got to talking about it, she wished that somebody would have mentioned something like ketamine or other psychedelics to her while she was suffering from gender dysphoria. So there is a role in that. And I mean, for somebody to go through what she did and never have a healthcare practitioner or one of her doctors even mention it, to me was amazing. And we had a very good discussion for a long time. And anyway, she's a big advocate and huge social media presence, and I was very happy to be able to talk to her because hopefully she'll spread the word. So it also took me to the Speak event in Speak Event Health in New York. So Speak events are a break-off of TED Talks. I was in New York. I gave a talk. You can look it up on YouTube. And it was basically what I presented to you tonight in about a 10-minute speech. So, all with no notes and no slides, just straight from the mouth. It was. I've gotten to do many podcasts, and I don't think it's hard to see, but I've been on STEM Talk with Ken Ford and Don Carnegas for the Revolutionary Ketamine, as well as some of the other things I do. So it's been quite a journey, being able to talk about these things. And I'll end with a sunrise. So I was the doctor for the Dakar Rally for 5 years. One of those things another adventures of my life, and I think there's a sunrise. I think there's a change coming. I think people have something to look at in the future. That my main point is, if you were, or a loved one, were suicidal or had very bad depression, would you consider ketamine? Would you consider it for your loved one? Would you even know about it? I don't know. Those are the questions of tonight, and questions I hope you go home and research the heck out of and ask yourselves, ask each other. It's not for everybody, but it's an option when your loved one or child is going down the drain, trying to take their life. And anybody who's seen that know what that's like when an adolescent is determined to take their life. It's a very scary moment. And I can't imagine any parent who wouldn't even at least consider it. So that's the overall message for tonight. I wish you all the adventure of your life. And this is my daughter Charlotte, my wife Mylene. This is our French house where I live part-time. And then I want to, one last, Dr. Ken Ford. I wouldn't be up here tonight if it wasn't for Dr. Ford and his interest in what I do, and so I just wanted to make sure I gave him a thanks and prayers, and thank you, Ken. So, thank you. Yes, sir.
Thank you for your presentation, Dr. Edwards. And I'm a big fan of osteopathic medicine, body heal thyself. And endorphins are a great thing for people to feel happy. I just noticed you didn't address whether or not ketamine suppresses the production of endorphins. I didn't see that anywhere in your presentation.
Yeah,
so could you talk about that?
No, there's not a lot. It's a good question. I haven't run across any research that specifically measured the endorphins. Most of it revolves around measuring BDNF and mTOR and cortisol and things like that. I think the endorphins, that you might get from exercise or other drugs. But I don't know the answer exactly to that, but I would say most people come out of a ketamine or most psychedelic experiences with a sense of hope. And that, I would think that involves some change in endorphins for the better. But that's a good question. I haven't, as many studies as I've read on it, I don't think anybody's measured that. So it's a good question, but I would say it helps. I would think, but yeah. I think him, and then, yes, sir.
Thank you for mentioning the word spiritual. And in the first part of the topic, your talk, you mentioned the word hopelessness, and that has to do with worldview. So it seems to me that this mental health issue would be a great place to start with you mentioned, and you're including holistic with the word spiritual. It seems to me the mental health situation can be greatly improved by a holistic approach, and that would include spiritual, working with the worldview, diet, exercise, etc. So I think
Absolutely.
And that would be a great chance to get well and then get drug-free, to be able to actually have somebody that was healed and not just dependent upon ketamine.
That's a great point. I mean, it's a multimodal approach, and it takes, you really got to find the right team when it comes to getting out of ruts. You can't just depend on one thing. Certainly not just ketamine or other drugs or even antidepressants. And most of us don't. In allopathic medicine, we don't think about that when we run into walls. Well, maybe it's time for an out-of-the-box consultation. And but when you're seen, it takes 5 minutes. You have 5 minutes with, who knows, the mental health or the practitioner, your family doc or whatever, and you bring this up. How are you going to get anywhere with that? So there's definitely parts of the healthcare system that has to change, especially in this area. So it's on the behooves of you to do your own research and put people in your corner that are going to help you. And in this day and age, I don't know how it's going to change. Maybe with the new administration a little bit, who knows? I don't think so. But I think you have to be your own best advocate.
Do you have time for one more question?
I think he had yeah.
Thank you very much, Dr. Edwards. I thoroughly enjoyed your talk.
Thank you.
The natural question for me is, if you're enjoying success like you have been in your programs, 82%, one of your slides showed, people making vast improvement.
Yep.
Why is it so difficult, and I think I might know the answer, why is it so difficult to get the U.S. government to stand behind ketamine? Is it a bureaucratic wall?
Okay, yeah. So it all started with, as you remember, in the Vietnam War, for those of you old enough to remember, which president put the kibosh on all psychedelic research, made it a Schedule 1, meaning it has no human use or benefit whatsoever, and it's a dangerous drug. And Nixon did that for LSD. He did that for just about every psychedelic. And therefore, there were no research dollars funneled into that kind of research. And it wasn't until late 1990s when a UK team discovered that ketamine was effective for bulimia and anorexia nervosa. And then that spilled over into the Yale research, which showed that it was useful for depression and then eventually suicide. Then the NIH took up a will to live, will to die study and showed that ketamine could stop suicide. So there was a 50-year gap almost between, or I'd say, 30 to 40 years gap between when they stopped the psychedelic research and things like ketamine came into the vogue. But the funny thing is, we always knew ketamine stopped depression or helped depression, because you can actually read, there's a part in my book where Dr. Edward Domino wrote a piece, and he's anyway, they had people there for ketamine and phencyclidine abuse. And this is a middle-aged woman, I believe, and the doctor asked her, so why do you keep using ketamine? Oh, that's simple, doctor. Ketamine works so much better than the antidepressants you prescribed me. And that was in 1974, I think. So we've known for a long time. But it's more complicated to say why the government won't get behind it. There's a lot of political things, but as I said, there are many politicians nowadays, much more than there ever was 10 or even 20 years ago, that now support, especially with the veterans, the veterans who've become politicians have seen the effects of psychedelics on veterans. And most of those people are pushing for its acceptance into mainstream society. And as I said, that includes Robert F. Kennedy. So with that, we'll see. Yeah.